this one. And I will share my screen. Rightio. So thank you so much for spending your Thursday lunchtime with me. The idea here is to spend about 35, 40 minutes discussing the role of telehealth within the context of allied health in the NDIS. Now, as it would happen, I am actually working from home at the moment. I would normally run these sessions from one of our clinics, but my son got sent home sick from school yesterday, so I am here at home running this one. Now, what that means is that normally I would kind of have one of our team to be able to support and provide some sort of admin assistance and guidance as we go through. But because I'm doing this from home, I don't have that person with me at the moment, which is fine. We'll be able to continue on as normal. But like I've said, what I'm going to do is I am going to record this session. So for the people that jump in late, you'll be able to access this recording whenever you want it. I will also encourage you to pop any questions that you have in the chat. In going through and in preparing for this workshop, I expect that there will be some questions. And so what I'm going to do is I'm going to create a separate video that I will forward through to everyone that registered after we finish up today with the specific answers to those questions. So instead of kind of going backwards and forwards myself, I figure it would be easier just to collate them all together and then send them off in kind of like a packaged format. As well as the slides. So I'll send through a copy of the slides, so feel welcome to use these however you want in your own businesses and with your teams. So in preparing for today, I had a bit of a look through the list of participants, and there was a few of you that I already know and a few that names were a little bit new. So I thought I'd spend just a minute describing who I am, and then potentially like how I am going to be approaching today's topic of telehealth for allied health in the NDIS. So my name's Andrew. I am an exercise physiologist. I graduated EP in 2006. So I've been working as an EP in a couple of different capacities for the last, 15 years. For those that, exercise physiology is a fairly new profession to them, we're essentially using exercise as our primary tool to be able to help people to achieve their goals. So you will find exercise physiologists or EPs in hospitals, in gyms, in GP clinics now, and also in the private sector, working within Medicare, Department of Veterans Affairs, and for myself and my business in the NDIS. So we are a registered provider. We have been so for about 6.5 years now. And I, as a practitioner, I have been involved in using telehealth for my clients as well. So I can see telehealth through the lens of a practitioner. But also as the director of Rebound Health. So we have 3 clinics. We've got about 28 team members at the moment. We are based on the northern beaches of Sydney, and probably 60% of what our business does is in the NDIS. So for our team, we sort of come from a background of exercise physiology. That's kind of our mainstay. But as we've grown over the past few years, we've now included physiotherapy, dietetics, and occupational therapy, particularly adult psychosocial disability occupational therapy. That tends to be where we spend most of our time. I'm also the co-director of Rebound Academy. So the Rebound Academy is an education and training resource to assist exercise physiologists to sort of level up and become proficient in providing services within the context of the disability sector. So we work to mentor and guide practitioners and business owners to be able to provide better care and better services to participants that are accessing exercise physiology through the NDIS. And finally, I am a mentor at Clinic Mastery. So Clinic Mastery is a business development, clinic development organization. So we help business owners create and grow clinics. Now, that is now international, and that is across many, many different disciplines, including psychology, OT, speech pathology, etc., etc. So through those 4 different lenses, I'm kind of coming at this content of telehealth in the context of the NDIS as a clinician, as a business owner, as a mentor to both practitioners and to business owners. So we are here today to talk about telehealth, allied health, and the NDIS. And the question that I kind of posed is, well, does it work? The answer is yes. It sure does. So from all of those different lenses, it's apparent that it works across disciplines. So whether it's an exercise physiology, physio, OT, dietitian, speech pathologist, whatever, it absolutely can work. One of the key components to it working is that it reduces the barriers to access services. So for some of the participants that we are working with at the moment, and for some that some of our colleagues work with, it can reduce the transport barrier. So whether that is because participants are relying on external providers to get them to and from appointments, or the cost of transport is prohibitive in them accessing services, telehealth is an option there to be able to take those barriers away. It can also, from an individual's perspective, reduce anxiety. So, for people that are accessing service for the first time, or there's some concerns about them that they might have about getting into, sessions in the community or engaging with other people, being able to provide therapy in the context of people's own homes can really help them manage and control that level of anxiety that might come about from new and different contexts that they're working in. From a geographical location perspective, if people are rural or they're in remote locations, it enables them to access potentially in an easier way practitioners from different locations. So we're removing the barrier of location from being able to access services, as well as time. And again, I'll kind of lean back into that idea of being in a rural or remote location where, as a practitioner, I might be going out to work with a participant in their own home, but because I'm kind of out there and I'm visiting multiple locations, my availability to be able to engage with like a certain community might be restricted in terms of the time that I've got able to do that. Whereas if participants are able to access me through telehealth, there's a lot more diversity in my ability to be able to engage with them and kind of match up our calendars so that we can kind of work together to find a mutually beneficial time for us both. It allows participants to access specialist care and support from practitioners of their choice, regardless of geographic location. So what I mean here is that, I am an exercise physiologist, but as an exercise physiologist, I actually specialize in working with people with a psychosocial disability. So those participants that want to access my services, they can speak directly to me. Similarly, like if you wanted to engage with, for example, a occupational therapist that had a special interest in mental health, that the participants themselves have the choice to be able to engage with providers that they want to engage with, as opposed to just the one that that is available in their local area. And again, that's particularly valuable in those regional and rural areas where we know that the availability of all allied health, but particularly psychologists, OTs, and speech pathologists is really lacking. It reduces travel time and the reliance of transportation services. I kind of touched on that a little bit earlier. It allows participants to engage with service providers in the comfort of their own home. And, like we said before, that can help to manage some of the anxiety or the discomfort that they might be feeling in engaging with new providers or in locations that they might be provoking for them. It allows for continuity of care without disruption due to travel or lack of support worker or transportation. And so a good example here is, for example, what happens with the floods a year ago, where we noticed that, participants weren't able to get access to their regular services because physically there was a flood in the way. Like they couldn't physically get to those providers, or vice versa, the providers couldn't get to them. So there's a greater degree of continuity of care because we're not having to rely on travel to get to and from participants' homes. We're also able to sort of remove that barrier where a support worker or a transportation service is reliant on getting that participant to our clinic and to our services. Because we're able to provide this directly to them in their own home. And finally, and again, I touched on this a couple of times, that being in the comfort of your own home or in a place that you feel safe, it can reduce isolation. It also can reduce distraction. If you're in an unfamiliar setting or if there's lots of noise and lots of things going on, it can detract from the efficacy, the benefits of that service, because we're kind of not able to focus as well as we would like to, as opposed to doing it sort of in the comfort of your own home or in a place where you feel safe and comfortable. So they're kind of the positive. That's the positive story when it comes to telehealth. But there are some challenges, and it's important to kind of recognize what those challenges are. And as providers and as participants, to be able to think of, well, if we're going to engage in this service or this method of service, what are some of the challenges that might come up, and how might we be able to put some contingencies around those challenges? There can be a lack of computer or digital literacy. So people might not have the knowledge or the resources to be able to set up a Zoom meeting or to set up an iPad so that they can engage in their provider. Or, in the case where we're using the support of a worker to be able to assist that, if that person's not there to be able to assist in the setup of the Zoom meeting or whatever it is, that can put a bit of a dent in that treatment at that particular time. It does require access to an appropriate device. We're all probably sitting here today on computers or smartphones or iPads. So, the use of telehealth, while you can certainly use a telephone to be able to have a conversation with someone, potentially, you're lacking some of the rapport, you're lacking some of the, certainly as an exercise physiologist, it's a little bit hard to get somebody exercising the way that we want them to if we can't see what they're doing. So, having an appropriate device is really important. Having an appropriate space as well. So whether that is for privacy, if you're having a conversation, a vulnerable conversation with an occupational therapist or a psychologist, or a dietitian, being able to have that conversation in a safe and appropriate space is really important. Again, like from an exercise physiology context, if somebody has reduced mobility or is unsafe due to them having a high falls risk, we really need to put a bit of thought into how we could control that space. What could we do? What safeguards could we put in place so that we're not putting somebody at risk on the other end of a Zoom call if something unexpected were to go wrong? And like I said there, that specific one can be mitigated by having a support worker there or a support person there who can assist that participant physically during the session if that's what's required. Communication difficulties. So, again, if we're working with someone who experiences difficulty in getting their voice or their opinion across, and they might use a support worker or carer to be able to assist in that communication, and that person's not there, it makes it a little bit harder for providers to be able to provide that same level of care, as opposed to if they were sitting across the consult room from us. So again, it's just making sure that we have a safeguard in place that, if we know that we are working someone who has difficulty communicating or getting their message across, that we just ensure that there is somebody there to be able to help that person get their voice across. Now, it might, continued use of telehealth might increase the reliance on the carer, and it might reduce community engagement. So it's kind of, two sides of a coin here, where, we want to be able to, as providers, we want to be able to help people. We want to be able to, understand what people's NDIS goals are and then provide tailored solutions to them. Now, like I've said before, the reason why people can access telehealth is, there are a multitude of reasons why people decide to access telehealth. But it's important for us as practitioners and providers to look through the lens of, what are the goals of the individual? What are they hoping to achieve by engaging through our services? And if part of those goals are around engagement in the community, improving confidence in navigating transport, building relationships, then we kind of think, well, would telehealth be the most appropriate medium to be able to hold that therapy session with them? Maybe yes, because you're able to do it in the comfort of the home, because there's a reduced reliance on travel and all these sort of things. But on the flip side, might we be holding that person back from achieving some of those goals that they are working towards with us? It's not necessarily black and white. It needs to be run through the lens of, what is going to be most appropriate for the person, and obviously ensuring that we are co-designing treatment by having their input into what is going to be most efficacious, most beneficial to them. Now, we've obviously learned, certainly in my own clinic and the clinics that I work with, that, this pandemic that we've gone through over the past couple of years has been a pivot point for us when it's come to the application of telehealth. Prior to COVID, telehealth certainly wasn't as prevalent, certainly wasn't as known as what it is now. And I think, now that we are hopefully, touch wood, sort of moving into a situation where we are learning to live with COVID, that we can reflect on, what we've learned over the past couple of years when it's come to telehealth, and think about how we can shape our service delivery for the future. And straight off the bat, a telehealth offering helps us help more people. There's a great opportunity for us to reach into communities that are underserviced, that there's high demand, and we can provide significant impact to those people in that area. So, telehealth is wonderful for that. There are more and more technologies that are coming out. So telehealth in itself can be integrated with various other assistive technologies to enhance the experience for NDIS participants. A very easy example of that is a remote monitoring advice or wearable sensors, something like Whoop or something like the Aura Ring, where we can receive real-time personal data that's delivered to healthcare professionals, enabling more accurate assessments and personalized treatment. The leaps and bounds that we've had in this area over the past 3 years has been terrific, and we'll probably see the rate of that increase fairly quickly over the next 10 to 15 years. It also enables practitioners to consult with colleagues, seek second opinions in a much more real-time way, and to be able to participate in conferences and virtual training sessions. So as providers, we can get access to better knowledge, better ways of doing things in a much more, in a way that fits around our schedules a lot better than, having to spend a couple of days that we've blocked out of our calendars attending conferences or flying interstate to attend kind of special interest groups and things like that. Telehealth, from a provider's perspective, has just enabled knowledge to be shared a lot easier. And, when it comes to working with participants, to be able to engage in multi-D case conferences, utilizing telehealth so that very quickly we can all get on the same page about how we can best assist the participant to work towards their goals over the course of, the next 6 to 12 months, depending on their plan. Now, as this expedited rollout of technology, particularly around telehealth, there are some concerns that we do need to make sure that as business owners that we are doing the right thing. And number one comes to mind there is around privacy and security concerns. So telehealth obviously involves a lot of the transmission of personal health information. And so as providers, we need to make sure that we have got, practice management softwares and softwares that allow people's personal information to be stored securely and in accordance with regulations. If you are a participant and this is something that is concerning for you, asking about the security protocols, asking if they have cyber insurance, asking about, how is my personal information going to be secured? Like these are concerns that we are hearing from our participants that we're working with. And we're always trying to improve what we're doing to sort of keep up with what is going to become expected of us as, we utilize technology more and more within this space. As a sort of a direct correlation to that, there will be changes in regulatory and reimbursement options for telehealth. So it's important for us as providers to understand what our obligations are, not only just in terms of the storage of personal information, but also how we are communicating and providing a safe environment for people to do that. And then finally, there's this sort of reliance on technology idea where telehealth, as we're sitting here today over screens, it relies on technology. And so things like internet connectivity and the platform that we're using to be able to have a conversation today, which is Zoom. If we are relying on telehealth without understanding that we should have a contingency for, what happened if Zoom didn't work today, or what happened if there was I sent the wrong link to this meeting to you, that I should have the obligation to make sure that there are contingencies in place for the participants that I'm working with if Zoom's not working or if the phones aren't working, so that we can provide that continuity of care for our clients, which we were trying to use telehealth to solve in the first place. Now, coming out of the lockdowns and sort of, 12, 18 months on, there's research coming out now about how telehealth was utilized in the context of the NDIS for allied health providers specifically. So I'm going to walk through just two very quickly research articles that have come out recently. So during COVID, about 57% of participants continued services in person for at least one allied healthcare support. 28% had their services cancelled for at least one allied healthcare support. Now that was due to lockdown restrictions and providers cancelling services because of an unwilling or unable to transition to a remote delivery of services. And 63% transitioned to remote delivery. So they did transition to a telehealth version of allied health support for at least one support. And of that, 66% were via video, so via Zoom, 34% were via telephone. So 63% transitioned to remote delivery. By my maths, that means that 37% did not, which is quite a big number in terms of the number of participants that are on the NDIS. Now, I'm not saying that that's a bad thing, but it's just a reflection of what happened. So almost 2/3 switched to a remote delivery, whereas a bit over 1/3 did not. In the same study, for those that had allied health consults delivered remotely, 2/3 were happy with the privacy and security of their consultation. 54% found the technology easy to use and felt comfortable communicating through the consultation. 75% felt safe during their consultation. 59% believed that their care was effective. 12% believed remotely delivered consultations were better than in person. And 32% indicated that they were likely to choose such services after the pandemic. Now, I was kind of reading through those statistics, and at first glance, it kind of painted a pretty happy picture about telehealth. And then you kind of flip those numbers around and you kind of go, well, if 32% indicated they were likely to choose to use services in the future, kind of meant that 78% weren't. 12% believed that remotely delivered consultations were better than being in person, which means that 88% felt that they were, right? And so I think the important distinction here is that it's really important for us to not just assume that because we had to use those services during the pandemic, that people will naturally want to continue on. It should be about a conversation of choice and control. It should be a conversation about what is going to be better delivery for both the participant and the provider, so that we can make sure that these numbers that we're seeing in terms of people's satisfaction of the service is not just a reflection of the provider wanting to sort of be a bit more streamlined in their calendar, but lean more into the fact that we want to work with individuals and understand what is going to be better for that person that we are working for. And like we've said before, understand what some of the challenges that people face in engaging with telehealth and working through with them what safeguards can be put in place, what contingencies can be put in place to be able to have them access telehealth in a very seamless and secure way. Now, like I mentioned before, I am an exercise physiologist, so this data came specifically for exercise physiology out of the pandemic. So typical reasons for not offering telehealth delivery. We sometimes in our clinics will use the word client instead of participant or patient. It's just a generalized term that we use for a customer that's engaging with our services. And so this language comes directly from the report. So the client or the participant, their physical or cognitive incapacity. So it's not appropriate for a telehealth to be delivered. And that's also reflected in safety. So that there might have been safety concerns for a participant to do exercise in their own home without supervision or without proper equipment or resources to be able to do that effectively. A clinician reported reasons for typical clients not adopting healthcare. Personal preference was one. So 80% sort of, it wasn't their preference to utilize telehealth. Physical capacity and access to reliable delivery platforms. And that number, 38%, is pretty consistent with what we saw in that previous research, where participants just didn't have access to either the technology needed, reliable internet services, or a reliable platform to be able to do this well. And again, similar to the previous study, Zoom and the telephone were the most commonly used platforms for exercise physiology specifically during that period of time. So here's just two quick examples of people that we are working with right now who we are using telehealth with. Now, the person on the left there identifies as female, 47, who has a diagnosis of CP. Now, this person actually lives locally to us, but due to transport challenges, they just can't get into our clinic. They use transport for other reasons, specifically getting to and from work. And so we provide telehealth consultations to this person. And why we feel safe and why we feel like this is a mutually beneficial arrangement is because we are able to provide, for this specific person, we are able to provide a safe and clinically effective environment for the goals that we are working on with this person. You know, the plan that we've developed with them, what we're doing, the regularity of our treatment. We feel, and they feel confident, that telehealth will help them to achieve their goals successfully. So for this person, telehealth is the preferred option. On the right side there, we have a person identifying as female who's 50, who has a psychosocial disability and complex mental health diagnoses. This person lives in regional New South Wales. And for the reason why they chose us is because we had one of our team who specializes in a particular area that this person wanted assistance with. So they were able to access us. There weren't local providers who had kind of that level of or the experience in this area that they were kind of looking for. So we were able to work with them, and this person engages in OT with our services. And again, like we are able to provide a platform and a safety and a mutually beneficial agreement for us both to be able to help this person work towards their goals. So two different examples of OT and EP where telehealth has been an appropriate use case for people. But conversely, you know, there are situations where it's not appropriate. And again, like as a provider, it's important to have those conversations with people, with participants, and ensure that, you know, we are providing a safe and effective treatment for them. So here's your kind of takeaways from today. So telehealth can work. We should absolutely take individual preferences into account when we are discussing the method of delivery for our services. And it's incumbent on us to ensure safety and appropriate access to technology, and to have a contingency plan if something were to go wrong. Those should be communicated effectively to the carers, to the participant, to you know, anybody that might be working with that participant on the ground, so that we're not leaving them high and dry when it's, you know, 1 o'clock on a Thursday afternoon and we've got an appointment and the internet goes down. Right? We should have clarity on what those next steps are, that we can still provide some access or some resources or some, in our case, therapy to participants that have scheduled into their time to meet with us on that particular day. So they're kind of the three key takeaways, is that telehealth absolutely can work. It's proven to work. It's proven that some participants actually enjoy it more than face-to-face. But it should always be a conversation about with participants about, what is going to be the best delivery platform for your services. That rounds out my presentation for today. Like I mentioned at the start, if you jumped in late, these are my details. I have recorded this session. I will send this recording along with questions that have been sent through, and there have been a few, which is great. So I will shoot a different video and I will send that out to you all with the answers to those questions. But if you'd like to reach out to me directly, there's my email, there's my phone number. Once again, I really appreciate you taking your Thursday lunchtime out to sit and have a chat with me about telehealth and the NDIS. If you do have any questions, please reach out. Other than that, have a lovely Thursday afternoon. Take care, and we will see you all very soon.